Setting: Community Health Center. You see a 40-year-old man who is going to visit Nigeria in the next month. He is concerned about the medication because he had depression in the past. Now let's look into the task. First one says, begin with warm and friendly greeting. Second one says, find out the details regarding the visit, that is, places and length of the visit. Third one says, recommend doxycycline for malaria prophylaxis. Explain no contraindications for patients with history of depression. Fourth one says, explain the dosage of medication, that is, 100 mg with food for 2 days before the trip, during the trip, and 4 weeks after the trip. Fifth one says, stress the importance of medications and mosquito bite prevention measures. Sixth one says, give reasons for long dose of doxycycline. It allows time for multiplication of parasites. Seventh one says, find out the reason for patients' reluctance to take medications over a long period of time. The last one says, explain the details of the possible side effects: heartburn, stomach upset, increased risk of sunburn. Then warn patient of risk of not taking medications if malaria is contracted, heart or kidney problems. Now let's get into the role play. You can start like, good morning, my name is Sarah. I'm one of the registered nurses working in this community health center. May I know your name and age for documentation, please? Then interlocutor may respond by saying, good morning, miss. My name is Alice and I'm 40 years old. Then respond to her, hello, Miss Alice. What brings you here today? Then interlocutor may respond by saying, miss, I am planning to visit Nigeria as part of my business trip in the first week of next month. However, I recently came to know that I need to take some medications during my journey, but have a history of depression in the past. So I am a little confused about the medications and its importance. So can you please explain me in detail? Then respond to her saying, I completely understand your concern, Miss Alice, but do not be worried. I am here to help you. But before proceeding further, I would like to get few more details about your trip. Is it okay with you? That is, can you please elaborate me few things about your trip? Then interlocutor may agree with that. Then continue by asking, tell me how long you are going to stay in Nigeria? Then interlocutor may respond by saying, nurse, I'll be there for almost a month. Then ask her, okay, Miss Alice, are you going to visit rural or urban areas? Then interlocutor may respond by saying, nurse, I'll be visiting mainly in rural areas. However, if time permits, I may visit some cities too. Then respond to her saying, thank you, Miss Alice, for giving me the details of your trip. From your explanation, I understand that you're going to visit rural areas in Nigeria in the next month and you're going to be there for almost a month. Am I right, Miss Alice? Then interlocutor may agree with that. Then continue by saying, okay, Miss Alice, you need to be a bit careful when you travel to Nigeria. Let me explain you that in detail. It is recommended that travelers who are going to Nigeria should take prescription medicines to prevent malaria infection. Depending on the medicines you take, you need to start taking this medicine multiple days before your trip as well as during, then after your trip. Before explaining in detail, let's see what is malaria. As you know that malaria is a serious disease that spreads when you are bitten by mosquito infected by tiny parasites. When it bites, the mosquito injects malaria parasites into your bloodstream. Basically, malaria is caused by parasites. If it is not treated or prevented, malaria can cause severe health problems such as seizure, brain damage, breathing difficulty, organ failure and death. Therefore, I strongly recommend doxycycline for malaria prophylaxis. But do not be worried, this medicine has no contraindications with your history of depression. I hope you're following me, Miss Alice. Then interlocutor may agree with that. Then continue by saying, apart from that, I would also like to let you know the dosage of the medication. That is, you need to take 100 mg of doxycycline daily with food for 2 days before the trip, during the trip, and 4 days after your return. Are you following me, Miss Alice? Then interlocutor may respond by saying, nurse, I don't really like to take medications. So instead of taking medications for a number of days, can I just try to avoid getting bitten by mosquitoes like mosquito bite prevention measures? Isn't that enough? Then respond to her saying, your concerns are quite sensible, Miss Alice. However, it is extremely important to take the medications along with mosquito bite prevention measures. Please understand that you're going to visit the high risk areas where malaria is common. Please make sure to stay safe from mosquito bites. Protection from mosquito bites is the only thing you can do to prevent onset of the disease. I hope you're clear now. Then interlocutor may respond by saying, okay miss, I understand the importance now, but I'm not really happy with the long medication regime. Then responder saying, okay Miss Alice, your worries are really understandable. However, the reason for the long dose of doxycycline is absolutely necessary. If you are not taking proper medication, that may allow time for the multiplication of parasites, and finally you may get various health problems as we discussed just now. Therefore, it is essential to take the full dosage of the medication. I hope you understand the seriousness. Then interlocutor may respond to saying, nurse, I'm ready to take the medication. However, I'm a little worried about the side effects. That's why I'm a bit reluctant to take the medication. Then responder saying, I can sense your worries regarding the side effects, Miss Alice. Do not be worried. I will explain you the details of the possible side effects. Then the interlocutor may agree with that. Then continue by saying, most common side effects of medications are heartburn, stomach pain, nausea, vomiting, headache, and increased risk of sunburn. However, all these side effects are easily manageable by following the medications on time. So I strongly recommend you to take the suggested medication. So you will have a worry-free travel. Is it okay with you, Miss Alice? Then the interlocutor may agree with that. Then continue by saying, in addition to that, I would also like to provide some more information. That is, if you do not comply with the preventive malaria medications, or if you're traveling without medications, the risk of not taking medication can lead to situation more severe than you imagine. That is, if malaria is contracted, even heart and kidney problems may occur, and also there are chances of breathing problems, organ failure, anemia, and low blood sugar. So it is highly recommended to take the medications as we discussed already. I hope you are with me, Miss Alice. The interlocutor may respond by saying, okay nurse, now I understood the importance of the medication, so I will definitely take the medications as you recommended. Then responder, I'm very glad to know that you understood the importance of the medication compliance. Do you have any more questions for me, Miss Alice? Then if the interlocutor does not have any questions or concern, you can wind up the roleplay by summarizing like, so far we have discussed about your trip to Nigeria and the importance of taking recommended medication. I hope you understand that. If you have any more questions or concern, you can contact me at any time. I'll be happy to assist you. So thank you, Miss Alice. I wish you a happy and safe journey. Thank you guys. Our roleplay ends here.